Thoracic outlet syndrome. Thoracic outlet allows unobstructed passage of the neurovascular bundles from the root of the neck to the axilla. Signs and symptoms occurs if some restriction of the passage of the neurovascular bundles between the shoulder and the neck, and there may be many factors that may be involved, including the tight neck muscles or abnormal muscular attachment onto the ribs, cervical ribs, either calcified or fibrous, and postural causes. Patient will normally present with numbness, pins and needles, and through one or both arms. Neurological symptoms include the pins and needles and pain. Predominance in 90% of the people are vascular, and they may also complain of incoordination of the muscles, weakness, and pain, particularly in the hands and fingers. The symptoms are generally worse with sustained overhead activity and position, and it is quite common in the weightlifters and carpenters or in people who are overweight or have a very poor posture. So the diagnosis, what observed is depend on whether there is a predominance of the vascular or neurological causes, and typically one will observe some form of numbness, muscle weakness, and in the later stages the wasting, especially of the intrinsic fingers muscles and the thumb muscles. And if the causes are primarily vascular, a decrease in the radial pulse may be felt in a sustained shoulder abduction or blush discoloration in the hand when down by the side, and the venous symptoms may also be present, such as edema and swelling. So, diagnosis begins by the history and physical examination, making sure to cover the neurogenic symptoms like pain, paresthesias, and motor weakness, vascular, including cold discoloration and claudication. Lastly, I'd look for edema, diminished pulses, and atrophy of the intrinsic muscle of the hand. Investigation also include the chest X-ray and CT scan to look for the cervical ribs, bony abnormalities, osteophyte changes, and intervertebral disc narrowing. The differential diagnosis of the thoracic outlet syndrome include the carpal tunnel syndrome, spinal compression syndromes, degenerative cervical disc disease, and arthritis. So, in the ulnar nerve thoracic outlet syndrome, normally there is involvement of the fourth and fifth finger. Potential symptoms include the pain and paresthesias of the medial aspect of arm and hand, as well as atrophy of the hypothenar and interosseous muscle. If the median nerve is compressed, then index and middle fingers are involved. The scalene triangle is the anterior portion is made up of anterior scalenus muscles, and the posterior side is the scalenus medius muscles, and inferior side is the first rib. A subclavian artery and the brachial plexus runs in the scalene triangle. If the arm is found swollen and dusky, there is a worry about the venous compression or thrombosis, Paget Shorter's syndrome, and usually it is diagnosed by doing a venogram, and that is very important. If the arm is pulseless, I will worry about the arterial thrombosis or arterial compression, and will need arteriogram to diagnose. And if it is both, then we can do a CT of dual phase involving the artery and the arterial phase and the venous phase. So the diagnostic tests include the maneuver that is positive. There is a loss or decrease in the radial pulse and reproduction of the symptoms. The AdSense or scalene test: hold the deep breath, extend the neck, and turn head to the opposite side. The costoclavicular test: military position, Halstead, draw shoulders down and backwards and narrow the costoclavicular space by approximating the clavicle to first rib. Hyperabduction or the right test: abduct the arm 180-degree. Roos test: holding the arm 90-degree abduction with the elbow extend, pulse, 3-minute stress test of opening and closing hand, um, Patterson or Novak test reproduction of the symptom in 1 minute of elevation of arm. So, to diagnose neural thoracic outlet syndrome, we perform the ulnar nerve conduction study. It is specific for localization of the nerve compression and calculation of the nerve conduction velocities in that particular nerve. Treatment depends on the physiotherapy and will address the faulty neck and back postures and joint mobility and mobilizing the joints and postures correction exercises. Tightness of the neck musculature, in particular the scalenus, can be decreased through stretching and retaining of the shoulder girdle muscles and the stabilizing muscles of the neck and thoracic spine, such as longus colli, lower trapezius, serratus anterior, are also retained and strengthened. Modifying household activities and exercise routines is important for the positive long-term outcome, and initial manual physiotherapy can speed recovery and is best combined with the prescribed home exercise program result from conservative treatment and can be very successful in 70 to 90% there is resolution of the symptoms. The neurogenic symptoms are more common. They include the pain, paresthesias, neck, shoulder pain. Paresthesias work with the sustained effort, and arterial symptoms include cold, weakness, fatigue, diffuse pain, and the venous symptoms include effort-induced thrombosis, edema, discoloration of arm, and there could be a vasospasm. So the ulnar nerve stimulation, there are 4 point tested, decreased velocity across the location, thoracic outlet, then there are compression of the nerves across the elbow, there is ulnar nerve entrapment, and across the wrist there is carpal tunnel syndrome. And if the ulnar nerve velocity is less than 59, it will need surgery. Normally it's over 70. Slight decrease is 69 to 66 to 69. Mild is 60 to 59, and moderate, that is 55 to 59. So in surgery, the head and neck of the first rib are removed with rongers to avoid injury to C8 and T1. If the cervical rib is present, it usually articulates with the first rib. And to add dorsal sympathectomy, separate pleura from the vertebra and find the sympathetic trunk and clip above the T1 and below T3 ganglion and ganglions, and the chains are removed. Thank you. If there's any question, then you can write in the comment and we would like to answer the question or make another video on that topic. Thank you very much.